our 2022 Status of Women report. And this has been a phenomenal project. I want to congratulate the team that has been working on this for probably the last 8 months. And I have a few of them at the dais with us today. I want to single out Lisa Bordeaux, who's relatively new to WWA, and just to how this massive project set forward. And with her as co-leader with Carla Horton, one of our longest members. And leading our research efforts with Dr. Sheila Glatsky. So the team seemed like it was a cast of hundreds, but it was probably just 24 or so. And I want to ask all of those who worked on the project to just stand and be recognized. We also had perhaps, 24 contributors from different organizations and partners, and I also want to recognize those as well. So the report we're revealing today essentially answers one fundamental question: how are women in Westchester faring? And the presentations that you will hear today, the data and the vignettes, really amount to a report of 117 pages. And no, we're not going to do 117 pages today. We're just going to give you a sample of what is in the report. So I think we're ready to roll. And I just want to show you what's coming next on our agenda today. So you'll hear next from Lisa, who will cover the executive summary, which is a broad overview of the report. And Sheila is going to talk about the socio-demographic highlights. And then we'll hear about 5 sections of the report: health and women, violence against women, women and housing, women and immigration, and family care. And then we'll have time for some Q&As. And then at the end, we encourage all of you to head over to our tables, where we invite you to join us in addressing some of the disparities that you'll hear about in the report. So with that, I'll turn the program over to Lisa.
Good morning. The 2022 report on the status of women in Westchester was a true team effort from the start. And Carla and I would like to acknowledge the hard work of every single person who brought this enormous endeavor to completion. A year ago, a team of 20 set out to update the 2016 report. We focused primarily on the concerns of women of limited means, as well as marginalized populations. We documented both areas of progress and accomplishments that have occurred in the last 6 years, as well as highlighting ongoing areas of concern. As you will hear, the report reveals a mixed picture of how women are faring in Westchester. The report is divided into 10 sections, each written by a team of contributors focused on a particular area. The 5 sections shown on this slide will be highlighted by our speakers today. You can see the names of the team leaders, but they could not have done it alone. And so we applaud all of the team members that worked alongside them on this project. These next sections will not be presented today, but you can discover them as you peruse the full 117 pages of the report, or navigate directly through hyperlinks to each section. The 2 consistent factors emerged above all others for their impact on women's lives, and by extension, their families and communities. These are affordable care, housing, and childcare. These remain perennial issues facing women some 6 years after we highlighted them in the 2016 study. On affordable housing, there is no town or city in Westchester where the rent for a 2-bedroom home is affordable to the renters earning a local hourly wage. And about 90% of the heads of households in the homeless system in Westchester are women. On childcare, despite efforts like the Westchester Works Child Care Scholarship Program, childcare remains unaffordable for large numbers of working families, availability is limited, and quality is uneven. And yet, in the face of this enormous need, the childcare workforce, predominantly women and women of color, remains one of the most poorly paid of all occupations. These two factors have an outsized effect on virtually every other aspect of a woman's life. By the way, example, mental health, school, work performance, even domestic violence are integrally affected by the lack of those basic needs of having a secure home and children well cared for. Another key factor which emerged is that while Westchester is becoming increasingly diverse, there are great disparities by race, gender, and geography in almost every sector examined, whether it be housing, health, financial or economic welfare, domestic violence or immigration. People of color lag behind their white counterparts. This is not news to many of us here, but these disparities demand our attention and call us to action. There have been signs of progress since our previous report. The data reveal improvements in poverty, unemployment, wage disparities, education, and even longevity. Poverty declined from 9.6% to 8.4%, and this was true across all major ethnic groups. Hispanic individuals are living longer. Percentage of infants born prematurely and with low birth weights has declined. School suspensions have been cut in half, and women are stepping up to lead, as the percentage of women holding Westchester County government positions is up significantly. Also encouraging are the advocacy efforts over the last several years by WWA and many other organizations and individuals. These contributed to successfully passing the Green Light Bill and Westchester County's Pay Transparency Law, which took effect this past November. And yet, in wages, despite the fact that the median income has increased in all categories of education for both men and women, wage inequities between men and women persist. Full-time employed women in New York State make only 84% of the weekly earnings of men. And in education, while there have been gains, both Black and Hispanic women lag significantly behind white women. Closely linked, there's a substantial gap in STEM opportunities for girls and women, both in higher education and in career choice, limiting access to higher paying STEM jobs. And in leadership of both corporations and nonprofit organizations that were cited in the 2016 report, there has unfortunately been a decline of women in senior management positions. Most in need in our community are first the families of working households headed by women and children, particularly those who are income constrained and lack both affordable housing and childcare. And second, seniors, particularly those living on limited incomes, many disabled, and lacking affordable housing. Unfortunately, the data also masks stark disparities which persist for women of color. These are further exacerbated by the intersectionality of these factors. Being Black or Hispanic, being single, being poor or homeless, being a mother, especially of young children, being elderly or disabled, have cumulative and compounding effects. And yet, the data is not available to fully track the intersectional effect of these factors. And one conclusion of this report is that we need to more consistently track this data on a granular level to understand the compounded effects in order to more accurately measure and understand our progress. Acknowledging and understanding these problems has impact. The 2016 report led to significant changes in policies which affected the lives of women. The 2022 report builds upon that work. It shows us where we need to prioritize going forward. The value of this report lies in the contributions by the experts, Close to 40 individuals and 30 organizations contributed to the report their specific recommendations for resolving many of the issues facing women today. It is clear that more work needs to be done by government, the private sector, and community organizations. We hope that this report provided a roadmap drawn up by those most knowledgeable of the terrain. We can make strides towards change. It is up to us as WWA members, as individuals and organizations, and as a county to ensure that we do everything in our power to make ours an equitable community and to improve the quality of life for all of the women in Westchester. And now onto the report. The socio-demographic highlights will be presented by Dr. Sheila Klatsky, who also authored this report. Thank you very much.
Okay, good morning. When I agreed to author the 2022 Status of Women Report, I did so with some trepidation. Normally, the 2020 census would give us reasonably current data from which we could draw conclusions about the status of women in Westchester County. However, intervening events such as COVID-19 and inflation, to name just two, created impacts that are still emerging. And even over the period in which the report was researched and written, conditions have changed. And some of the most recent government data could not be incorporated into the report due to their late arrival. At the same time, there are some basic demographic indicators that show how much Westchester County has changed over the course of the last decade. First place, I'm not sure that slide reflects it, but the population of Westchester has grown by 5.8% to just over 1 million in the last decade. Westchester has become home to a wide variety of people from diverse racial and ethnic backgrounds, with the multiracial population tripling since 2010, going from 3% to 11% of the population. The population in Westchester continues to age, and the birth rate has fallen dramatically. These are just some of the, and these are all facts which are in the handout, also in the report itself. The 85 plus population, for example, has grown by 29% over the last decade. Almost 27% of the Westchester population now identifies as Hispanic, with the fastest growth rate of any ethnic group in the county. The median age in Westchester in 2020 was 41.1 compared to 39.7 in 2010. And as I said, the growth rate for seniors is 29% over the last decade. Birth rate dropped from 52 per 1,000 to 43 per 1,000. Let me digress a little bit, but as the individual primarily responsible for the research and the writing of both the 2016 WWA report on status of women and the 2022 report, I also have a few points of hard-won wisdom that I would like to share with you. First, the time lapse between measurements is a serious limitation to the data that we have available. Both the housing data and much of the health and healthcare data are approximately 5 years old. And unfortunately, those are the most current data that we have. I'm not suggesting that we need complete reports every 2 or 3 years. And nor can, and here I diverge slightly from Lisa's remarks, but nor can data limitations be overcome simply by more timely or more granular indicators, which have potential problems of unreliability due to small sample sizes, and also potential invasion of privacy. When you get down to small numbers, you are potentially identifying people. But we do need more frequent and ongoing updates on a few key unambiguous indicators that are relevant to the status of women, and we need those on an ongoing basis. Second, we need to ask, are existing indicators measuring what we want to measure? What are the implications, for example, of the fact that poverty has declined over the last 5 years, but that 37% of Westchester households cannot meet the minimum cost of household necessities? What does it take to support a middle-class lifestyle in Westchester? And what does a middle-class lifestyle entail? Does it require one income or two? Are women in Westchester leading happier, healthier, less stressful lives than they were a decade ago? We need more meaningful measures of personal and community well-being, and particularly as they pertain to women. Yet another issue relates to implications for action. Gender-based wage disparities, for example, continue to persist, as Lisa pointed out. However, there are a wide variety of underlying variables which affect gender wage disparities, and they are cited in the report, and I suggest you take a look at them. We know, for example, that the sorting of women and men into different occupations and industries accounts for the largest amount of the wage difference. However, given the fact that resources are finite and there's a limited capacity for engaging the attention of stakeholders, advocacy efforts might better focus on pay equity for specific occupational groups, such as those that are disproportionately filled by Black and brown women. Nursing assistants, for example, home health care aides, and so forth. Data is essential. The data alone will not suffice, and the fact that available data do not fully reflect that we are still recovering from the ravages of COVID-19 meant the report inevitably pivoted from an emphasis on quantitative data alone and towards the incorporation of actionable insights and recommendations. And in the process, it became a much richer and more collaborative document. With that in mind, I encourage you to read the report thoroughly, paying particular attention to the insights which stem from the professional experience of WWA member organizations and from the lived experience of the women that they serve. I would also suggest that we try to identify bellwether indicators, indicators that suggest the beginning of a trend. This requires ongoing measurement, interpretation, monitoring, and reporting. An effort like that which the Westchester Community Foundation has begun with its admirable Westchester Index, and I encourage you to look at that as well. But again, specific to the status of women, we need more unambiguous, reliable indicators, particularly related to the status of women. To cite a few potential trends from the report, the increase in teenage pregnancies starting in 2019 after a decline, the increase in reported domestic violence incidents in 2021 after a steady 10-year decline. Also, surprisingly, the improvement in the percentage of rent-burdened households between the two 5-year periods of 2010 to 2015 and 2015 to 2020. It's a small improvement, but it is an improvement. And the question is, are these the start of trends, or are they simply momentary glimpses in the data? Also, we might pay particular attention in the report to promising prototypes. And for example, I suggest that the report's Wednesday pandemic success story of Baby Pub's Learning Center, which combines women's entrepreneurship with also meeting need for affordable childcare. Also, although the data does make use of national, the report does make use of national data at times to interpret trends, I caution against assuming that national data apply directly to Westchester. Westchester is not a state, it still has a nation, and macro data will not allow us to solve micro problems. Finally, I note that there are a total of 69 recommendations in the report, all of them deemed important by one or another WA organization or individual. And that calls for further action on the part of WWA membership to identify and prioritize and advocate on behalf of those recommendations, which have the most important implications for action and the greatest likelihood of successfully moving the needle for women in Westchester. And I know that the agenda will certainly attend to that. I encourage you, those of you who feel strongly about an issue, to take the time afterwards to go over to the tables and sign up to get involved in some of these action areas. Remember, it's not the magnitude of the problem, it's the impact of the solution. We need evidence for impact, and we need insights for action. The work is just beginning. Thank you. Next up, Women in Health with Andrea Rochelle.
Yay! That kind of welcome. I've been tasked with giving a little update on women in health, and so we thought we'd start just by illustrating some very important data. While 85% are vaccinated, there have been over 2,800 deaths attributed to COVID. And the life expectancy has risen overall, but there are still tremendous disparities, as you can see. Infant mortality is 2 times as high among Black populations as that for white infants. Maternal mortality is 3 times as high for Black women as for white nationally, and 39% of women pre-pandemic cited mental health as a major concern, and obviously this is an ongoing issue. I included a little bit of information about the breakdown of the insurance distribution at Open Door in general. And we know that the impact of the uninsured population accessing healthcare, we know that there are tremendous gaps. And we want to be able to bridge those gaps as quickly as possible. Many of our patients are accessing Medicaid services, and yet, there are still significant issues because we're not able to care for everyone that comes in through our doors. So, of course, we're going to highlight some progress and, of course, some ongoing challenges. So, in 2021 and 2022, we began to see more patients increase in routine care, so people coming back not just for COVID care, but catching up on breast cancer screenings and other types of important screening services. And yet we're still far, far behind. We've been able to see improvements in disparities in Black health that are now being recognized, which is wonderful. This is going to help us bridge a lot of information. We're going to be able to bridge some of those gaps and be able to really, make an impact in the way that we care for people of color, women of color, especially Black women. We've seen improvements in health insurance coverage, and yet we know that there's still significant aspects of health coverage that are impacting the lives of women. We know that there are significant gaps in insurance coverage, and so co-payments and deductibles, very high deductibles, still prevent people from accessing services. We've seen increased awareness of mental health issues, which is really terrific. We've seen a decrease in stigma, and through the use of telehealth, virtual care, and innovation, impact the lives of women. And it impacts, wellness, their wellness and overall health. We see significant issues in food insecurity and domestic violence, as you heard previously. And some significant ongoing challenges are around the mistrust and misinformation around COVID-19. And even with programs like Trusted Messenger, who we're out there fighting a lot of the misinformation, we know that there's a lot of work that we still need to do in this area. There are still significant gaps. The report shows that 100% of residents in Scarsdale were vaccinated in comparison to northern Yonkers, where it was 77%. And so there's still a lot of information that needs to get out there, and we need to do more. And then again, the access to affordable health care, and this just speaks to the fact that it's not just access to affordable health care, it's access to health care in general. What we see is that, there are challenges in workforce. We are experiencing that, especially in the healthcare sector. We see how significant a problem this is when patients are having a hard time getting an appointment because we just don't have the providers available to see every single patient. And so we have to get really creative and innovative in the way in which we are delivering services. And so we put together some recommendations, of course. We need to improve social determinants of health. We need to continue to build trust in our communities and identify those key priorities and working collaboratively with partners on solution-oriented programming. We need to expand healthcare access and expand the healthcare workforce, which is, again, a significant issue. And obviously we're seeing a lot of this on the news with our nursing shortages and just, the fact that we've lost a lot of our healthcare staff because of burnout, post-COVID. And this is a significant concern. Expand anti-bias training. This is a significant issue, and I think most of us around the room are making we're putting our effort into this area. We want to make sure that we're educating ourselves and, of course, our communities. Fund programs to increase healthcare access in Black and Brown communities. And then, of course, physical and emotional health care are interconnected, which is why we must continue to expand mental health programs. Okay, and so I included a slide that just highlights some of the social determinants of health that are being seen at Open Door. We saw over 12,000 patients, and we served, we provided services to over 23,000, around 23,000 services that affected social determinants of health. And some of the issues that were highlighted were certainly food insecurity. We know that there are a lot of patients that are really struggling with access to food, and so a lot of the work that we do at Open Door is making sure that we have very strong partnerships with many of you around the room and making sure that our patients have everything that they need so that they are able to prioritize healthcare. 61% of the patients that we served at Open Door are in fact women, and we have quite an extensive array of supportive services through both patient advocates and navigators and care managers. And I think what's really important is that we continue to support each other, support our women. We see a significant number of women at Open Door, and we make sure that they are served in a culturally competent way, and we want to make sure that we empower them because they are incredibly important, and they are the building blocks, and they are the glue that holds so many of our communities together. So on that note, I'm going to pass it over to Carla Horton.
Good morning. Let's just start with the definition of domestic violence. It's a pattern, and I stress the word pattern, of coercive tactics used by one person in a relationship to establish, get, and maintain control over the other partner. And these very coercive tactics can include emotional, physical, sexual, economic, and or psychological abuse. Now, victims will often endure the abuse for years, not knowing or reluctant to call out for help. And where can they go? They can reach out to the criminal justice system, the police and prosecutors. They can go to family court. They can access one of the nonprofit service providers like the Office for Women, Hope's Door, My Sister's Place, the Pace Women's Justice Center, and Legal Services of the Hudson Valley, all of whom contributed to this report. We are a fractured and underfunded system rooted in patriarchy and discrimination that really needs to put the safety of women and children first. I'll be presenting data and analysis from the report, and if you find it conflicting and confounding, you will not be alone. Let's start with criminal justice data between 2010 and 2020. That data shows a steady decrease, down 37% between 2011 and 2020. In 2011, it was 27 crimes reported for 10,000 residents. That dropped to 17. That said, in 2021, reports began to inch upward. We need to keep an eye on that. Meanwhile, domestic incident reports taken by police in the county actually fluctuate a bit more, but between 2010 and 2020, those figures, those reports also went down 15%. But now, we're expecting an increase because of the expansion of a county-wide domestic violence high-risk program. So we're working with the year for which the latest data was available. But while reports from the criminal justice system have trended downward, let's talk about the crisis lines run at Hope Store, my sister's place in the Case Women's Justice Center. You can see up there, we are 39% over pre-pandemic levels. Additionally, petitions for orders of protection in the family court as opposed to criminal court, those went up just 16% from 2020 to 2021. Now, while it is said that anyone can be a victim of domestic violence, the data from the state reflect female victims at 85%, and those we surveyed at Hope Store, the number is even greater at 93% for adults are women. That said, the fatalities are overwhelmingly women and children. In my 25 years at Hope Store, every domestic fatality that I can remember, save one, was a woman or a child. All of the others I can remember include Hilda Aguna. She was denied an order of protection and she was dead 5 days later. Now, Deborah Briggs Clancy, she had an order of protection, but also was stabbed to death in her bed while her 9-year-old son, Jimmy, cowered under the blankets at her feet. There was Loretta Dim and her daughter, Caroline. Amy Friedlander, she wanted a divorce. That was moving along. Her husband took a rolling pin and bludgeoned her to death, and then blew apart his daughter, Molly, 10, and his son, Gregory, 8, with a shotgun. Clearly, there is more we need to do. Sexual violence. Now let's turn to the 622 survivors of sexual assault who reached out for crisis support at the Westchester Medical Center between 2019 and 2021. As with domestic violence, these victims were overwhelmingly female at 87%. But here, additionally, we see stark racial differences reflecting increased risk for our Black and brown sisters. Blacks are 14% of the county population, but 28% of those going to the medical center for sexual assault services at a factor of 2. Hispanics are 27% of the county and Westchester's population, but 36% of the victims. Whites are 53%, but their number is 23% of those going for help. And while parents often tell their children to beware of stranger danger, we must expand that message to include and beware of who you know, as 64% of victims knew their assailants. We've made advances. Let's talk about that for a moment. Among them, the Westchester County Domestic Violence High-Risk Team, under leadership of the County Office for Women, where diverse systems are coming together to train police to assess and refer victims at high risk for homicide. Westchester County Safe Time Leave Law. Thank you, County. Now a victim can go to court, get paid for her time off from the job, or to move to a safe location. the Domestic Violence Survivors Justice Act, which gives the court discretion to re-sentence defendants who suffered abuse that led to their crime. And this has helped victims like Janitha Alston, convicted of manslaughter, and Nikki Armando, convicted of murder. Both have been defending their lives. The Adult Survivors Act created a one-year look-back window for adult victims of sexual violence. We actually now are requiring forensic evaluators to have biennial training. That was a compromise, we thought, on our part. At least one organization thought they should be eliminated entirely. And very importantly, there are increased protections related to guns, possession of guns. This legislation is particularly critical because the presence or access to a weapon in the home of an abused woman increases her chance of homicide by more than 500%. We have some recommendations. Make the safety of women and children a priority in court proceedings. Support meaningful outreach and prevention for both domestic violence, teen dating abuse, sexual assault. Increase the availability of trauma-informed and culturally and multilingually adept attorneys, advocates, and mental health providers. Simplify the courts, expand training for judges, expand affordable housing and child care. And since at least 3 organizations in this room will lose $2.4 million over a 3-year period due to loss of federal funding, we ask for the state to step up and create an adequate, stable funding stream. Before I close, let me share these words from someone we'll call Linda. My life seemed picture perfect. I had an advanced degree, 2 daughters, and a husband who provided very well. But little by little, his increasing anger and hostility wore away at the veneer of our marriage. As COVID-19 isolation took hold, the situation worsened. In October, while I was out shopping, my husband assaulted one daughter. The other daughter called the police. By the time I returned with groceries, the police were at my house filing a domestic incident report and ordering my husband to leave. Later that week, he was arrested, and we secured an order of protection. A friend, be a friend. A friend suggested Hope Store. I met with an attorney and a counselor who worked with me in safety planning, sorting out my options. I decided on a divorce, which is now in effect. My children are stable. I'm finally securing financial independence. I feel stronger every day. Now let's welcome Tiffany.
Such sobering facts and stories. It's hard. My name is Tiffany Zazula. I'm a staff attorney with the Housing Action Council, and I'm here to highlight the impacts of housing, both on our region and then, of course, more specifically on women. I do want to take the opportunity to share some of, I think, the opportunities ahead here in the county, and then some, of course, of the challenges. As everyone knows in this room, I think we know that housing is a powerful shaping force. It impacts all of the topics that we are covering in the report, education, it impacts healthcare, it impacts children's opportunities, and of course, economic development. The Westchester Housing Needs Assessment, which was published in 2019, provided a comprehensive overview of the housing needs in the county. And it also provided municipalities essentially a baseline for which progress can be measured. And if you go onto the Westchester County's website, you can find the housing needs assessment. I encourage everyone to actually take a look at it. You can visit it and see municipality by municipality, sort of the median incomes in the municipalities, and also some of the pricing of housing. This table that I'm sharing, there we go, and of course it's hard to see, so take a look at the report. This table is one of many that highlights just one of the realities that our families are facing in Westchester. The study shows that the monthly gap between the average two-bedroom market rate, which by the way is approximately $2,500, and the rate affordable based on the renter's wage rate is clearly doesn't match up, right? We're going to note here that actually to afford a $2,500 market rate unit, you need to be making about pretty much $48 a wage, hourly wage. And then it's broken down by certain municipalities that shares with you some of the hourly renter's wage that range from between $16 an hour to at most here $30 an hour. Clearly, again, not affordable for those hourly rates. And so the study goes on to reveal, and again, take a look at this chart more closely, but there is a $1,600 gap here between that market rate and affordable, and what we consider affordable. The study goes on to reveal that half of the rental households in Westchester are cost burdened. If families are spending more than 30% of their income on housing, we have to imagine then this is less money for food, less money for health care, child care, basic needs for our families. If we have to travel and commute long distances between where we live and where we work, we're making longer days for ourselves, longer commuting times, again, all adding up to less time with our families, which is clearly important. The lack of housing impacts seniors, millennials, people of color, middle-class families, single parents, 80%, which are headed by single moms, and others, of course, who are struggling with rising rents and lack of home ownership opportunities. The impact on single mothers is even more crushing. The median income of a single mother is less than half of the median income for married couples. The result being that about 90% of the heads of household in Westchester's family homeless system are women. But the cost is especially borne by the more than 2,300 children who find themselves homeless in Westchester County on any given night. Now we know the challenges, we've heard the challenges, I'm sure many of you have seen them in the paper or have heard your communities talk about it. We know there's a lack of infrastructure, lack of funding, lack of land, lack of sometimes support by our neighbors. And we know the needs that are being requested by us. Just recently, the governor announced 800,000 new homes in the next decade for the state of New York. And in Westchester alone, we need about 11,700 new affordable housing units in our county. Some of our citizens think of affordable housing as a trade-off to other considerations: open space, high school enrollment, commuting, services being provided. But housing isn't a commodity. We need to realize that we can have all of those things, open space, great schools, and all of that, and still have affordable housing. Housing can determine whether Westchester County communities and families thrive or if they merely survive. So we know that an investment in housing and affordable housing and our families can afford is an investment in our future. Here's the good news. We are seeing a shift in the narrative on housing. The support and the prioritization by the state, the county, our elected officials, businesses, not-for-profits, and our citizens is helping to position affordable housing as now a metric of success for a sustainable and healthy community. We are seeing more and more conversations, more financial support, and critical thinking regarding the issue, coming both from the state and the county. For example, the governor just released her strategy for overcoming the housing crisis. The county's provided an increase in funding to housing efforts overall, and we're seeing a critical review and assessment of underutilized space and office parks for the consideration of it turning into residential. We also are seeing more conversation, more support, more dialogue happening through successful efforts like the Welcome Home Westchester campaign. And we have 31 communities with inclusionary zoning ordinances and many with ADU or accessory dwelling unit ordinances, all trying to promote affordable housing in their communities. So what's working but needs more support? The report highlights a few recommendations for action. The county should continue to maintain the annual funding levels that it does for housing through the New Homes Land Acquisition Program and the Housing Implementation Program. This helps increase the level of affordable housing production that's desperately needed, so we want to continue to thank the county for their support, especially in the recent budget. There should be developer incentives to increase the number of units affordable to extremely and very low income households, to encourage builders who are willing to go above and beyond the minimum in producing such units. A county-managed supplemental source of funding could also help increase the number of units funded and help with funding gaps. The county should continue to advocate at the federal and state level for ESHI-type rental subsidy programs that help establish the financial viability of affordable housing for lower income households. And we should be incentivizing municipalities to develop and implement local affordable housing plans. These types of plans are a chance for us to bring people together, connect affordable housing to community values like equity, diversity, and sustainability. And through that planning process with local leaders and residents, we can begin to build a shared understanding of how new homes can meet the needs of current and future residents. These plans can typically be something that a municipality looks to essentially decide how and they're going to meet those housing objectives for themselves. And we should continue to advocate for the production of accessory dwelling units through technical assistance, incentives to homeowners and creating ADUs. Just recently, the state awarded a few nonprofits in Westchester $4 million to work in 4 communities on ADU technical assistance. But more is always needed. We have a unique opportunity right now to improve the housing policy and get ahead of the challenges we face. Westchester County should be both a great place to live, that's close to New York City, with good transit, great schools, and a great place that provides wonderful housing options for all people at all levels of income. The bottom line is we need new housing of a different shape, size for all residents. As the Westchester Women's Agenda, we, I think, are all excited to continue our work and work with all the local leaders on solutions to support those who want to live and work here. We are in this together. We should work on this together. Families love their communities. They want to stay in their communities. They want to stay in Westchester. And we as a strong coalition can overcome this challenge by working together to create and help preserve housing. Thank you. To talk about women and immigration.
Welcome everyone and thank you. I think first you can't talk about the status of women in Westchester County without acknowledging the incredible power of the women in this room. So I'd like to give a round of applause to all of you. Please stand. I'm going to be talking about a variety of issues, and before I do that, I want to point out that a lot of the progress that has been made as it relates to immigration and to the rights of women couldn't have been done without the boldness of some of the elected officials in the room. And I want to make sure to comment on the incredible impact that that has had when you stepped forward and advocated for some of the progress that I'm going to be talking about. I also, yes. I also want to acknowledge the work done by some of our good friends at Community Resource Center and the work that they did to help contribute to this. So, Joanne Martinez and Janet Fry, and also to Esmeralda Hoscoy, who also contributed to this. And the last thing I have to say is that I'm also very proud to serve as the co-vice chair of the Westchester Women's Agenda, and couldn't do it without the support of my co-chair, Elisa Keston. So thank you for indulging me and letting me do that. I always want to do it during my presentations, and I never get to it, so I said today I was going to do it at the beginning. So let me just start by pointing out something really important on this bar chart that you see here to your right. All you need to really look at is the bars. See how the bars are going up? Those are the number of immigrants in our country over the years, and see how the projection going forward is increasing. And I want to point out to you that I am specifically showing a chart that was put together some years ago, so that you can see that it should be no surprise to any of us or to our country that the number of immigrants in our country is growing, and we need a long-term policy to be able to integrate immigrants into our community. So just note the increases. So even though we may see peaks and valleys over time, and even though we may see restrictive immigration policies, we're still seeing this bar chart play out. This is a very critical part of our economy and our country, and we need to prepare for it over the long term. Now, certainly women are migrating to this country in higher numbers than ever before, and they are leaving their countries, escaping poverty and violence. But I want to also focus on the very significant role that they play in the economy of this country. Women are domestic workers, they are healthcare workers, they are childcare providers, a whole variety of services that they offer that are basically propping up dual income families in our country. And certainly that's happening in our county. And so very critical that we continue to make progress that includes them in each one of the issues that we're talking about today. So whether we're talking about healthcare, whether we're talking about childcare, whether we're talking about domestic violence, very important to take into consideration the role of the immigrant women, regardless of immigration status. And that is my main message to this group today, that regardless of immigration status, we need to make sure to apply all of our policies, all of our funding to the women that live, the immigrant women that are propping up our economy and making a significant difference. The one other point I want to make regarding immigration is the barriers that do exist. Even though we have seen improvements in healthcare coverage and childcare coverage, as I said earlier, we are still seeing people excluded, and those are often undocumented people. And so we need to make sure to make advances to include them in all of our advocacy work. We'll talk just for a minute about some of the progress we have seen. First, Westchester County was able to pass the Immigration Protection Act, and this was legislation that made sure that ICE and law enforcement, among other things, that ICE and law enforcement would not communicate immigration status with each other. We also passed an anti-wage theft act in 2018. At the state level, one of the most significant changes for women was the driver's license that passed in 2019 that you'll hear referred to as green light from time to time. And also the fund for excluded workers, $2.1 billion, was put in for those workers who were an essential part of our workforce, an essential part of our economy during the pandemic, but were excluded from any kind of national relief funding. And of course, I also want to mention the Office for New Americans, which is progress that has been made that is the Office for New Americans created by Governor Hochul's office, actually by the former governor, that provides a variety of funding. for immigrants and creates opportunity centers for immigrants. But there are significant challenges and barriers that exist, and I've mentioned some of them, so I'm just going to highlight again. Significant barriers to qualify for services. So we make funding available, we make services available, but then the devil is in the details, and women, often undocumented women, are excluded from those services. And this happens in housing, childcare, healthcare, accessing mental health, and even in workforce abuses. I'm going to jump right into some of our recommendations. These are some of the legislations that are currently pending, that have been proposed, that will make a significant difference to the status of immigrant women in Westchester County and in the state. If you look in the study, you'll see details about what each of these mean. But access to representation in immigration court, immigrants right now do not have representation provided for them, and they rely on nonprofit organizations if they can't afford it. Unemployment Bridge Program provides unemployment insurance for immigrant workers who may not qualify for unemployment insurance now. Funding additional immigration legal services. Coverage for all is healthcare coverage that includes undocumented people. New York for All takes that Immigrant Protection Act that our county was so progressive in passing, and that keeps ICE and local law enforcement from collaborating with each other, takes it to the state level. And I want to also mention right to counsel, and that is eviction protection for tenants in court. So I want to emphasize to the country that our county and our state economy need an immigrant workforce. It is the thirst for this workforce that compels people to come to this country. They leave their countries because of poverty and violence and abuses. They come here because we have a thirst for this workforce, and our economy relies on it. And I think it's important to understand the humanitarian role that we can play as a country in helping people, but also understand the extent to which our economy and our immigration policy are intertwined with each other, and that we actually have the ability to use immigration policy as a lever to affect our economy. And we do this by including immigrants regardless of immigration status, and including immigrant women in our policies. So thank you very much. And now I'd like to invite Nicole to talk about philanthropy.
Hi, good afternoon. Listening to everyone talk about healthcare, housing, domestic violence, immigration, just talks about the fractured systems we do have in the state and how much we really still need to fight for. And family care is no different. You know, family care is an essential component for working families, especially women, and it doesn't receive the support needed to fix its splintered system that it's had for a while. So our national approach to child care is to treat it as a private responsibility rather than a public good. In Westchester County, the child care desert rate was nearly 60% pre-COVID. It is now higher as we lost almost 50 child care businesses during the pandemic. Even though Westchester has over 36,000 regulated slots for child care, it does not meet the demand, especially for infants where our regulated slots are only 8% needed for infants. Availability for child care is a bigger struggle now than before as programs are struggling to hire staff. This is impacting enrollment as programs cannot accept children with the widespread staff vacancies. Child care programs have also had to raise their fees due to the high operational costs. Child care was already one of the largest household bills, sometimes even more than rent and mortgage, and you've already heard how much they're struggling with that. So, and just to give you a frame of reference, childcare for an infant in a center-based program can be as much as $23,000 a year for a family. Some progress has been made in New York State and Westchester County. New York State has significantly increased the family's income eligibility limits up to 300% of the federal poverty level. That would be for a family of 3 where an income went from $69,000 a year that they can now be making up to $92,000 a year. That's a huge jump for families. New York State also raised the reimbursement rate for family, for child care businesses that care for that care for children who receive subsidized child care financial assistance. The state also provided funds to child care businesses in way of 2 stabilization grants to assist with operating costs and hiring and retaining staff. Additionally, some new programs opening in child care deserts also received some grants, but in Westchester County there were only a few. Westchester County took an even bigger step by supporting child care beyond the New York State initiative. It made Westchester Works Child Care Scholarship Program possible, which allows families otherwise not eligible for assistance, who make up to 400% of the federal poverty level, receive payment for child care. The county's Department of Social Services also opened up eligibility requirements to include families seeking employment, attending college, trade schools, or other employment readiness programs. Even with this progress, access and affordability remains a challenge for many families. Child care workers are poorly compensated, and ongoing shortage of staff limits the ability to enroll. There is a shortage in infant and toddler care throughout the county, evening and weekend care. The cost still remains daunting, especially for families with more than 1 child and those not eligible for assistance. Even those who are eligible for assistance, for financial assistance, do not obtain it. I think that the national rate is only 10% access and receive assistance for child care. Additionally, the reimbursement rates to providers are not matched to the true cost of care. So, Westchester County has set an example, as I mentioned, for others to invest following the investment and support in child care. But the transformation that needs to take place can only be done with substantial federal funding. Build Back Better promised unprecedented child care funding. It finally showed a direct link between the access of reliable, affordable child care and people working, especially women. Sadly, the legislation faltered, and the reconciliation bill contained nothing for child care. Therefore, the national child care situation remains dire. So we ask that Westchester County continues to maintain the Westchester Works Child Care Scholarship Program, and that it adjusts its income eligibility levels to assist more families with higher living costs. We ask elected officials at every level of government to prioritize federal investment for child care with a sense of urgency. We ask that for incentives to attract and retain qualified child care staff, and we ask to fund apprenticeship programs to increase the child care workforce. So we had a lot of asks, but we still have more. Child care in Westchester is impacted by the New York State child care policy. We are lucky that the county executive and his team at the Department of Social Services, as well as the Board of Legislators, understand the fundamental importance of access, safe, and affordable quality child care. They have invested local tax dollars to child care to offer Westchester parents access beyond the New York State funding. This is a great accomplishment for the county. But because of the interconnectedness between New York State and Westchester regarding child care, we have to pay a great deal of attention of what is in and what is not in the New York State budget. The governor's budget for 23-24 contains some very good news for childcare, making more families eligible by raising the income level from 300% of the federal poverty to almost 350% of the federal poverty level. She also presented lowering the family share fee from 10% to 1%, which means it's less money out of the family's pocket. This was once 27% in Westchester. And adopting a categorical eligibility for childcare for families enrolled in our public assistance, such as programs like SNAP, Medicare, or WIC. This is all terrific, and until yesterday, the governor just announced some partially addressing the low wages of the childcare workforce. So she announced another grant to help retain and hire staff. However, it's not, without the substantial continued funding, it doesn't answer the question. Everyone's having trouble hiring staff, especially qualified people to be committed to the field. You cannot save quality environments. You cannot have, safe quality environments for children without engaged, dedicated staff. It was never okay to pay child care workers minimum wage, but now it's no longer a workable strategy. There are 97% of the workers are women, and almost half are women of color. So we expand our ask. So we would like to see New York State raise the income eligibility for child care assistance to 350%. When this happens, we ask the county to raise the eligibility for the Westchester Work Scholarship to over 400%. Westchester County should call on both New York State and Washington to increase child care investment to protect and expand the child care system. New York State should fund a short-term child care workforce compensation fund this year and then pass legislation for a new pay scale by 2025. New York State should increase the revenue stream of child care by reimbursing an enrollment rather than attendance, reimbursing on enrollment rather than attendance, and paying rates based on the cost rather on the fees charged. As the National Women's Law Center stated during the pandemic, I should say, the child care is the work that makes all other work possible. As the first and most influential step of a child's educational journey, our child care system should be universal, accessible, affordable, and of high quality.
So we've looked at 5 areas of our report, and there are probably another 5 more that you need to look at. We wanted to be responsible to our environment, so we didn't print 117 pages, but we encourage you to go to our website, www.agenda.org, and read the entire report. We do have the fact sheet with some of the stats that you can look at. We have some copies here.
Copies at the door.
So be sure to get yours on the mail. But really, we really want you to take a look at the entire report, particularly the action items. And I think based on what we've heard progress, we've heard challenges. And so I think it's fair to say that the picture for women in Westchester is mixed, which means we've got opportunities to address. And we encourage all of you who are here and all of your contacts, your collaborators, to try to work with us to address these issues. I really want to highlight all the members of the Westchester Women's Agenda. We are about 50 organizations and over 100 women. And we are all volunteers who are raising the flag on issues affecting women, because we want everyone to thrive in Westchester. So with that, I will now entertain questions from the audience. Please stand and identify yourself and where you're from and to whom you're addressing your question. So go ahead.
Oh, I never know who they're picking on. Hi, I'm Wendy Wallner. So, thank you. Super interesting. I wish we had time to finish the pieces that you said you didn't get to. So I'm interested in, on the recommendations, I usually don't need a microphone, but okay. So I'm interested in the recommendations. I'm born and raised in Westchester, raised 3 children here in Westchester, single mom. And I'm interested in that we're a small business community. I mean, I think most of us know here, the vast majority of Westchester is small business owners. I don't know the number, but I'm sure Sally or somebody here would know the number. Does the report continue with recommendations about what we should do as small business owners to begin to because I see the government's responsibility, but I think we all have a responsibility. That's the first part of the question. And then the second part is there a county that we should shout out in this country that's doing some of these things better or right or different that we can also learn from? I have like 29 more questions, but and again, I mean, it's super interesting. Sorry, you better take it. Yeah.
I just want to say, in terms of small business, one of the sections in the report deals with economic empowerment, and the statistics show that women-owned businesses are growing tremendously in the And in terms of other counties that are doing exceptional work, I don't really know offhand, but one of the things that we have recommended to our county, we're glad to know that they're beginning to engage in, is working with the Government Alliance on Race and Equity that allows counties to really dig into the data and look at the disparities, because as we know, all votes rise, right? When we look at those that are disadvantaged. So I would say you could look at the Government Alliance on Race and Equity website. There are counties that are already working on some of these disparities and trying to raise the vote for everyone.
Well, one of the things I want to say about small businesses from the domestic violence thing is learn more about domestic violence, learn how to identify and assess an employee of yours who might be in danger. Chris Templeman is in the building here. He's with Morgan Stanley, which at least once, if not twice or more a year, holds a program on domestic violence. And Chris, if you're still here, I think we're moving to doing a program for business in June that will help small and large business owners know how they not only can help protect one of their employees, but domestic violence doesn't stay home necessarily when a woman goes to work, and that abuse can follow her as well. So there are things that employers can do and know so that you can help protect yourself as well as the identified victim of abuse. And that's just in one category of service, domestic violence.
Can I add that I really appreciate your question. I think that's so insightful, and I think one of the things that small businesses could do is bring this report to your Chamber of Commerce throughout the county, so that all businesses can see the point that I think Carla is making, the extent to which all these issues affect your workforce and also affect the clients that you may serve. So I would strongly encourage you to share this report, and the report is laid out so brilliantly in that you can look at the recommendations and see how they might relate and pertain, whether it be the work that you do within your own business or any advocacy work that you might do as a business owner, an entrepreneur in the county, which I think would be powerful.
I just wanted to say, I believe the state of California just came up with a report on the status of girls and women. I haven't had a chance to look at it yet, but it's quite new.
Couple of things. Catherine Parker, I'm one of the Westchester County legislators. This was so incredible. I have every one of you for all the work that went into this incredibly meaningful, very long, but very enriched presentation. And to the point of, we need to get this message out over and over again. I will wholeheartedly be reaching out to Colleen to have all of you come and speak before my committee, which focuses on equity, because certainly that's an area that I see where we do have a lot of work to do, and we didn't even touch upon in this presentation some of the things that are also going on in the county focused on equity, like digital equity, and I see Meg Kafer in the front row. And there is a lot, and to the previous speaker's question, I do want to just say that, you know, I'm here with the vice chair of the board, Nancy Barr. We are very, very focused on how the county can do more to address equity. And when you look at the budget this year and you see $90 million that has been put in, and that's a tremendous, for affordable housing, it's a tremendous increase over what has happened in previous years. We've been steadily raising the number of scholarships for childcare, as well as really kind of giving a boost to all the childcare organizations. Again, focusing on all the issues that are laid out. We have more work to do. I would definitely want to have this presentation so that we can highlight some of the asks that have been made this morning. And again, thank you all so much.
Good morning, I'm Cheryl Brand, and I'm founder of Sister to Sister International, and I just want to certainly echo what was mentioned earlier and congratulate certainly Colleen Brathwaite as the chair and really the driver. Congratulations to you and the entire team. And congratulations to Dr. Sheila Klatsky, because Sheila not only did, you can give her a round of applause. Sheila not only did the first report for WWA, as was mentioned, but she also did the groundbreaking report for Sister to Sister International in 2019, the status of Black women and girls in Westchester County. So really want to shout her out. And then secondly, not to take up too much time, one of the issues that we have lifted up is Black maternal health. And as a matter of fact, we've been so pleased and proud to partner with WWA, Colleen, Kate Permit, the whole group on this issue. And we have established a Black maternal and child center of excellence. We've done a ribbon cutting. We're going to be partnering with the county and so many of you here. So it was mentioned in the report, I just wanted to emphasize that we really have to take a stand, and we really, when it comes to equity, need to make sure that we're promoting, that we're doing all of the undoing racism work in this field to support Black women and the birthing process. And I know you want to say a woman on that.
Good morning. My name is Nicole Benjamin, and I serve on the board of WWA. It's been a pleasure and my honor to serve under Colleen Brathwaite, our chair. Just getting a lot of kudos this morning. But my question is for Tiffany with regard to kinship housing. There's such a dire need, and especially in Black families as a result of the pandemic, and prior to that, kinship care has been prevalent. What are the statistics right now, and what's projected with regard to kinship care for Westchester County?
I don't have any current statistics on that, and I actually want to say that I do know that I'm pretty sure that the Westchester County Housing Needs Assessment is being updated right now, or it's about to be. Okay, we have a thumbs up. Yes, it's about to be released.
Define kinship housing. Well, grandparent housing.
So,
I know the Bronx was the first to develop.
I know the Bronx was the first to establish kinship housing, I believe in the 90s or early 2000s. I just wanted to Take action for Westchester County.
Yeah, and I know that one of our recommendations of the report, and I think Rose Noonan might be here, she can expand on this, was to expand the definition of special needs populations to include kinship housing, so that more funding can be directed towards that, because right now, again, what a lot of people don't realize is that the way affordable housing is funded is through certain, obviously, buckets of money, with certain definitions of groups, right, that are able to live in that housing. And so at this point, right, our advocacy is around making sure we can expand definitions to include kinship housing, so that we can expand funding for that type of housing, because we're seeing obviously more and more of it. And I think that an ADU, right, the accessory dwelling unit, and that communities and supporting that also helps with kinship type housing efforts, I guess. But I don't have any current stats unless Rose is here. She has stats, or does that have stats?
I think we've got some stats.
Oh, good.
So, in fact, on the back of the handout, you will have kinship care that's highlighted. But also, just to give everyone in the room a little bit of the top line, there are 12,684 children under the age of 18 living with a grandparent in Westchester. And that number is up 40% versus 10 years ago. There is an enormous burden amongst grandparents of color, and obviously we all know that the burden of COVID fell on people of color. And so this is significant. It has its own section in the report, and I encourage you to look more deeply into it, because it's a very important. Thank you very much.
I think Nancy, you wanted to add something?
Hi, Nancy Barr. I'm Vice Chair of the Board of Legislators and co-chair of the Families Task Force, which is a task force that our chairwoman, Catherine Borgia, started several years ago, and we are very focused. We have a subcommittee on this very topic of kinship housing, and we are working on trying to develop that for Westchester County. It is very, very complicated for a number of different reasons, but we do have people on the committee who represent Rose is on our task force, and Rich Nightingale and Kathy Howells is my co-chair on the Families Task Force, so she's on this subcommittee that's working on this issue. So happy to, include you if you're interested, and definitely want to look at the report and see what you say. So thank you.
Thank you.
Hi everybody, my name is Dana Levenberg. I'm a new Assemblywoman, and I see so many friends in the audience and on the panel. I'm so supportive and so grateful for all of the recommendations as well as the progress. And again, as a new legislator, I would very much appreciate if anybody could get me the bill numbers that have already been introduced, so that I can hop on as co-sponsor. And then for some of those recommendations, I just wanted to let you know that my committees include correction, housing, environmental conservation, library and digital technologies, and I know I'm forgetting one, and local government. So, if, I think especially for housing, I as town supervisor in Austin, I work closely with Tiffany on some of the efforts that we've made, but we know how tough it is with local governments and with infrastructure that sometimes comes up as an issue or an obstacle to building new housing. This is something that has been a passion of mine, and I will continue to advocate for housing. It's interesting to hear that term. I hadn't heard that term, kinship housing, before, and how it aligns with ADU housing. Somebody had mentioned to me at one point, maybe we need to come up with a different way to refer to ADUs, and maybe we should call it, aging in place housing, because that is also something that it can be used for, certainly, but because there's so much pushback against some of the, those sorts of initiatives, I think that it's critical that we find creative solutions. So I'm here I'm so excited to see, again, all the recommendations from all of these groups to make sure that we can continue to thrive here in Westchester and across New York State. Thanks.
Hi, good morning. My name is Marie Considine. I'm the Executive Director with NAMI Westchester, the National Alliance on Mental Illness. So I've worked with many of you. Many of the presenters today, and in the report, it echoes how strong the need is for mental health across all of these situations: domestic violence, child care, immigration issues, housing issues. Mental health crosses all of those lines, and it's really an honor that our commissioner is here today, Commissioner of Department of Community Mental Health, Michael Orth, and it shows how important that this organization is and the work that's being done is here in Westchester County. So I just wanted to let you know that all of you who are supporting all of those people, we can support you, that we have programs that can help all the people that you take care of, and all of our programs are free. And we've worked with many organizations in the county, such as Allison and others. Cheryl will be writing our article for this coming month in our newsletter. And we have programs for people who are related to faith organizations and bringing mental health to faith leaders and families, as well as people who are living with mental illness. So please contact us if there's a way that we can work together, because it sounds like all the people you're serving are struggling with mental health needs. So let's try to reach them all together.
If I could just add to what mental health and health in general is one of our focus areas in the agenda. So I encourage you to join Bree, and I think Tanya Weiss was here, who's from the Cancer Support Group. Come join with us to keep the focus on that area.
Thank you. So I'm Janelle Martinez with the Community Resource Center, and because so much of the percentage of the workforce in our county is nonprofit. 20% of the workforce is nonprofit, and many of the people who work in the nonprofit sector are women. And just speaking today with my colleagues about how the nonprofit sector is not paying adequate livable wages for us to live in this county, I think we need to address that. And that's not to say that we should not focus on housing, because we need to make housing affordable 100%. But we also we want to be culturally responsive to our community, and we don't want our people who identify with the people we're trying to serve to leave the nonprofit sector because they can't afford to work in this sector. So thank you to my colleagues and my people who keep bringing this up, and we need to do something about that.
Hello, I'm Natalie Blundell. I'm the founder of We Spoke here in Westchester, which advocates for equity for women in the divorce and child custody process. I'm also involved with CEDAW Westchester, for the Coalition for the End of Discrimination Against Women, and also for the Women's Declaration International, which is protecting the rights, the sex-based rights of women. My question to, I guess really to Colleen, would be, and thank you all for a great presentation, is rather than just have the report up on the website and for us to just kind of spread the word to send people there, is there also a proactive approach to distributing that to all of the communities, the report? There's so much good information that one piece of it, one part of the 5 that we heard today could trigger something within a certain community.
Sure, that's phase 2. We just got through phase 1, we're just getting the report done, which, as you can imagine, is a Herculean effort. So yes, we will definitely be working on phase 2, which is getting the word out as widely as we can. So stay tuned.
Good morning. I'm Laura Rossi with the Westchester Community Foundation, and I'm delighted to be here. And I wanted to make 3, possibly 4 points. and congratulations on this amazing report. It's going to be very helpful to us and to the philanthropic community. Point one, please do visit the Westchester Index and let us know if it aligns with what you are finding, because we are into phase 2 and 3 of the index, and we want these efforts to be moving together. 2, thank you for highlighting intersectionality and for the collaborative efforts, both in the production of the report and in everybody in this room, including with our elected officials and county commissioners, etc. 3, advocacy is important, policy work is important, and what I'm thrilled about and can't wait to spend all weekend reading is the highlights on the progress, because in this work, and particularly you're benchmarking, you're clarifying what's winnable, and we're getting better as a community. I mean, I personally sometimes feel like, oh, there's so much to do, particularly as a woman and as a mom, but we are making progress, and that's my big takeaway from today. And 4, to Wendy's question about other counties, so I'm sitting here thinking about that. I often think about, well, who knows how to do it, maybe Montgomery County, Maryland figured out housing. I don't know, how's that going? I think we're the front runner, actually. I'm sure that all of the experts have colleagues throughout the state and throughout the country, but we have our context. So I think it's important to look at the index allows us to compare to Putnam and Nassau and Rockland, but we're special here, and I think we are leading the way in many, many ways. So that's my feedback to you. Thank you. Thank you, everybody.
Thank you, and congratulations to the panel for an incredibly engaging presentation, to Colleen for your leadership at WWA. My name is Ruth Walter. I'm a former county legislator, hope to serve someday again, but I'm going to say 2 things in 2 different hats. The first, as a small business owner, I thank you for your question and for the response on this panel, because we can do so much in our own communities to reach out to different groups and to really support the workers that we have, and I promise I will take this to our chamber in Bronxville. The second thing I want to say, I put on my cybersecurity task force because I'm the chair of the Westchester County Cybersecurity Task Force. Today at 2, there's an online free seminar by one of our members, Roundtable Technology, Kim Snyder. You can find it on LinkedIn. It is extremely important that we all notice and pay attention to the fact that crime is coming into our homes through our devices. We are being targeted as individuals, seniors, students, municipalities, and most particularly in this group, nonprofits. So please take a few, it's a 1-hour free seminar, or follow us on the Westchester County website for cybersecurity. That's my message today. Thank you so much.
Before we go on to the next question, I just also want to again say thank you to our legislators who are here and our county commissioners, directors. We really value the partnership, and we look forward to working with you to address some of these disparities that we discussed today. We really value that partnership, and we're very pleased that we have the environment in Westchester that's very collaborative to work on these issues.
Hi, I am Meg Koifer from the STEM Alliance, and I have a quick comment and a question. I'm really happy to hear about the cybersecurity, and also to point out that Launch 1000 launched their entrepreneurism program, I think just yesterday. It's fantastic, so we can grow the next generation of entrepreneurism and small business leadership among women. They also have bilingual programs. The STEM Alliance is very excited to be offering our digital equity access alongside that program, including bilingual instruction, and we do touch on cybersecurity. And my comment is just really lifting and eager to speak with anyone here who wants to more deeply examine digital equity as a critical super social determinant across all of these areas. We know, for example, that the single highest indicator when you control for other elements of death by COVID was internet access. And that is not a causation, it's a correlation But that's a call for a digital equity plan here in the county. And also finding housing, applying for social services, moving into higher paid jobs, lack of skilled healthcare workers. And when we look at issues like Black maternal health, fewer than 3% of doctors are female Black doctors. If you can't see it, you can't be it, and the time is now to really advance those opportunities in STEM education, starting with digital equity. My question, just going back to the housing, on the definition of kinship, which personally was new for me, which also means we all can learn, and so thank you. My question is, and dovetailing with the nonprofit, is we are seeing people for whom we are advocating for higher salaries, and it's now splintering families because they have to move out of their shared Section 8 housing because they've priced their family out of living there. And so I'm just wondering if this is something that's being examined in the context of kinship housing.
Thank you for that question, Meg. I don't have an answer to that one either. I don't know. That's like that.
Well, it's an irony is that we're working to pay people more, and now we're splitting families and those young people.
And I know the families have to work like that.
Yeah.
Issue that I think that we
So Laura, again, one of our grantees is the Grand Power, one of our grantees is the Grand Power Advocacy Project at the Family Service Society of Yonkers. I would be happy to connect folks to that group if they're not already in conversation, but they're based in Yonkers. They're mostly grandmothers. They're doing a lot of work in Albany, maybe you know them, they're doing a lot of work in Albany. Around equity for kinship families. But they've also done a great partnership with the Macy Public Housing Project to put kinship families at the head of the list. So there's good work going on just in that one group that maybe folks can connect around with. So two more. So one, then one.
Hi, good morning. My name is Alana Schneier. I'm a consultant that serves the nonprofit sector and government. I'm also a school board member in my community. I have two questions. One was for Dr. Pulaski. I was just curious how the pandemic affected so much of the data and how that's accounted for, or did it throw off kind of when you do a 5-year look back, or anything that includes 2020 and sort of a range of time? Does the data kind of going on, particularly around domestic violence or other reporting, does that kind of change, alter the larger picture? And then I just hope, plant the second seed. I was just curious if in the recommendations, if there's any exploration of guaranteed income or universal basic income as part of the report.
In relation to COVID, the biggest problem is that there really are no data at the local level that address the impacts of COVID. There are surveys at the national level that do some of that data, but it's very limited in scope and it's local in character. New York State is doing a survey of COVID impacts. It's not out yet. There are also 2021 data are now coming out from the census and have been for the last few months, and those will show some impacts. But because we started this report 8 months ago, basically, a lot of those have not been included. We do wherever we can.
About domestic violence, I'm taking this from my head because we compiled 3 different organizations, for example, who operate crisis lines. That's Hope Store, My Sister's Place, and the Pace Women's Justice Center. Hope Store in 2020, I believe it was, had actually a 9% dip, short-lived, but a 9% dip in annual data. That was not true at Pace, and that was not true at My Sister's Place. And when I combined us all together to have a broader picture, we were up 39% over pre-pandemic. So when you compare 2019, before we had any impact, we really wanted to see where it was going. By 2022, that the 3 of us were up 39%.
Do you have time for 2 more questions quickly, please?
Hi, I'll be real quick. I just wanted to make note, I mentioned the Black Maternal Child Center of Excellence. We actually have a handout on it, and it certainly will tell you more about the program, one, but then secondly, you can sign up. We've got the Cheyennes on here on our team. You can sign up, become a community partner, and certainly be a part of helping us to undo racism and improve birth outcomes for Black women here in Westchester County and beyond. And then further, I just wanted to point out another member of our team, Cheryl Hunter-Graham, who's very well known doing work in this field as well. So we've got a great team. And then finally, as I pass the mic, we have also been very active in STEM and STEAM for Black and girls of color. We've been a leader here in Westchester County, cutting edge programming, and we have a sign-up sheet and certainly flyers on our program there as well. So we do look forward to collective impact and continuing to work together. Thank you again.
A woman.
A woman.
I know.
Good afternoon. No, it's no more. Thank you so much to the Women's Agenda for everything that you do, particularly today, and Colleen for your leadership, the whole team. This was wonderful and very insightful. I just wanted to encourage you all to be mindful and be a participant in county government. I want to acknowledge our Vice Chair, Nancy Barr, and Colleen Catherine Parker, and also legislator Erica Pierce, who had registered but turned out she couldn't attend today. But we hold committee meetings on a weekly basis, and we address all of these topics and many more. And I'm proud that the Board of Legislators was able to fund extra or increased funding for nonprofits in this year's budget, the 2023 budget, and as it pertains to health care, as I chair the Committee on Health, we've been laser focused on a lot of these issues, particularly mental health and how the pandemic has affected that, especially in our children. I cannot speak highly enough about Commissioner Michael Orr. Yes. And all that he and his team does. I started to say I was very proud that we advocated for increased funding to reopen 2 of the mental health clinics that were shut down under the Astorino administration this year, so that is forthcoming, and his team is working on that. We are very focused on insurance parity and the lack of it in mental health. We held 2 committee meetings on it. We have another one coming up. My health committee meetings meet every Tuesday at 1 o'clock. I hold the record for having the most committee meetings in a year. And I promise you I will continue to hold that record. But please, if you can't come in person, you can. But if you can't, they're online, virtually. You can watch anytime, get caught up. Again, Legislator Parker chairs the Human Rights and Equity Committee. We have a joint committee meeting coming up on LGBTQ+ rights and health and access to health care. And I really stood to invite you to come to the upcoming meeting on Tuesday at 1 o'clock. Did Allison leave? Oh, did she's presenting on digital, I guess we should say inequity and how that affects healthcare access. So please come. Meg, I wanted to particularly invite you to talk to you afterwards. But again, we cover a lot. So please look at the website and the meetings, and if you have any suggestions, this whole report is excellent suggestions. But if you want to speak to me offline about anything you suggest further, please, I'm more than welcome. Thank you, Lynn.
Okay, thank you.
Colleen, she's giving me
one more. Emily Saltzman from the County Executive's Office. I just wanted to represent the executive branch, County Executive Latimer, Deputy County Executive Jenkins, who all of you know. Thank you for your work, your partnership. I talk to many of you all the time. If anyone else wants to call me, please feel free. Your information, your insight that you give us is vital. I do want to add that this year marks a 37% increase in funding for the Women's Agenda organizations. You have, last year I said she was a little bit of a pit bull, and she said she wasn't, but you have an amazing advocate and organizer. Thank you for all you do. I look forward to reading and digesting every bit of the report and sharing it with our commissioners. We have the wonderful Michael Worth here and all the rest. Thank you.
Thank you, Emily. We certainly appreciate the increased funding, and we look forward to our continuing partnership with the county and with the state legislators themselves. Before you run off, please head over to our action tables. We want everyone who is available, who has time, interest in this finance, to work with us